Good evening and welcome to Health Chat. I'm your hostess, Caroline Speller, and today's special guest is Brianna Rosa, who is a specialist in the field of sexually transmitted diseases for the minority population and public health field. Today's topic will be about chlamydia and how it can be prevented. So, Brianna, can you please explain that for us?
Thanks for having me. And of course, chlamydia is a sexually transmitted infection caused by the bacterium Chlamydia trachomatis. Chlamydia is the most commonly reported sexually transmitted infection in the United States, with the highest rates in young adults ages 14 through 24 and minority groups such as African Americans. STDs in general and chlamydia specifically have both been identified as health priorities by the Federal Healthy People 2020 initiative. Despite a good understanding of how to prevent and treat chlamydia, the resources needed are scarce and almost non-existent in minority communities.
Well, we are looking forward to finding out more about this disparity. So tell us a little bit more about it. I know minorities are more susceptible to acquiring it. So why and how? And tell us a little bit about the population in Pitt County and why this issue matters.
All disparities matter because people of different races are treated differently, whether it be through insurance availability, biasness of doctors, and access. This is a very preventable disease, right? So if we can find ways to prevent it in this population, then we can help this disparity. Minorities are more susceptible because sexual health trends mirror other disparities such as poverty and income, employment, and education. African Americans experience chlamydia rates over 6 times higher than whites, followed by American Indians, Hispanics, and Asians. By learning about these racial and economic disparities, we can address the communities that need our help the most. African Americans and other minorities, 88% of Pitt County has some form of health care coverage, while the remaining 12% have no health care coverage, meaning that 12% is most likely not going to the doctor as they should.
Wow, and I understand you're looking to create a school-based program to help combat these high rates, correct?
Yes, we are looking to introduce a program that provides those who are not able to regularly visit reproductive health specialists with disability, whether they do not have insurance, cannot afford the price of a visit, have a hectic work schedule, or simply cannot visit due to transportation issues. They will have an opportunity to be seen.
What are some factors that also cause lower rates of routine and preventative health care in minority populations?
For these populations, the main factors is price, time, bias, and health care availability. They either cannot afford to be seen regularly, they cannot get time off work for a visit, they do not feel safe or do not trust their doctor, or there are no quality health care facilities around them.
What are the demographics of African Americans and other minorities in Pitt County?
Pitt County, North Carolina is home to a population of 176,000 people, from which 96.7 are citizens. The ethnic composition of the population is composed of 97,200 white residents, 60,600 African American residents, 10,700 Latino residents, 3,400 Asian residents, 400 American Indian and Alaska Native residents, and 61 Native Hawaiian and Pacific Islander residents. In 2017, in Pitt County, there were 2,095 new cases of chlamydia per 100,000 of the population reported, and 62,893 new cases of chlamydia per 100,000 of the population in North Carolina reported. This is an increase from the 2016 report, which showed 1,904 new cases per 100,000 in Pitt County and 58,078 new cases per 100,000 in North Carolina. For both years, Pitt County was ranked 7th in having the highest chlamydia rates out of North Carolina's 100 counties.
Wow, so this is something that Pitt County needs to focus on. Tell us some things that your program does to address this disparity, more so than other programs.
Previous school-based efforts focused on providing screening during a limited time period, which does not effectively work at reducing chlamydia rates long-term. For an infection this common, we need to provide year-round opportunities for these populations to be screened and treated. Partnering with schools to provide accurate and understandable prevention and detection, education can help increase the necessary awareness to lower the rates of chlamydia. Further, partnering with schools and community organizations to provide free or low-charge chlamydia screenings in school nurse offices or setting up stations in alternative settings such as recreation centers can also prevent high rates of chlamydia. By eliminating the cost and creating more readily available testing centers, we will be able to test and treat a bigger portion of the population.
In closing, since you are a specialist in the field of sexually transmitted diseases for the minority population and public health field, can you describe how your health intervention is related to a health behavior theory?
Our health intervention is related to the social ecological model. The social ecological model helps to understand factors affecting behavior and provides guidance for developing successful programs through social environments. Social ecological model emphasizes multiple levels of influence such as individual, interpersonal, organizational, community, and public policy, and the idea that behaviors both shape and are shaped by the social environment. The principles of social ecological models are consistent with social cognitive theory concepts, which suggest that creating an environment conducive to change is important to making it easier to adopt healthy behaviors. For example, how our health intervention relates to the social ecological model at the individual level is having knowledge about chlamydia risk factors. At the interpersonal level, it's having friends and relatives that have been affected by chlamydia. At the organizational level, it's having STD screening recommendations. At the community level, it's having accessibility and affordability of STD screening and prevention methods. At the public policy level, it's having a school-based education program to promote STD screening and prevention methods for African American teenagers between the ages of 14 to 19 in Pitt County, North Carolina.
Well, that's all the time we have for today. Thank you for talking with us. If you would like more information on this topic, please email rosab14@students.ecu.edu. That's ROSAB14@students.ecu.edu, or call in to 919-710-9812. Thanks for listening.